Every single day, 11,000 Americans turn 65, and most of them have no idea how Medicare actually works. They miss deadlines, pick the wrong plan, and end up paying thousands more than they should. If that sounds like you, or someone you love, this video is going to save you a lot of headaches. Welcome to Medicare Simplified, the channel that breaks down Medicare so it actually makes sense. No jargon, no sales pitch, just clear answers. In the next 10 minutes, I'm going to walk you through every part of Medicare, what it covers, what it costs, and when you need to sign up. By the end of this video, you'll understand exactly how Medicare works and which type of plan fits your situation. Let's get into it. Medicare is the federal health insurance program for Americans 65 and older. It was signed into law in 1965 by President Lyndon Johnson, and today it covers over 67 million people. You qualify for Medicare if you're a U.S. citizen or permanent resident who's lived here at least 5 years, and you're 65 or older. You can also qualify under 65 if you have certain disabilities or end-stage renal disease. But for today, we're focusing on the 65 and over path, since that's most people. Here's the big picture. Medicare has 4 parts: A, B, C, and D. Think of them as building blocks. A and B are the foundation. C is an alternative way to get that coverage. D adds prescription drugs. Let me break each one down. Part A is your hospital insurance. It covers inpatient hospital stays, skilled nursing facility care after a hospital stay, hospice care, and some home health services. Here's the good news. If you or your spouse paid Medicare taxes for at least 10 years, that's 40 quarters, your part of premium is zero. You already paid for it. If you didn't hit that threshold, you could pay up to $518 a month in 2026, so it's worth checking. Now, zero premium doesn't mean zero cost. Part A has a deductible. In 2026, it's $1,676 per benefit period. A benefit period starts when you're admitted and ends when you've been out of the hospital for 60 consecutive days. After that deductible, days 1 through 60 are fully covered. Days 61 through 90, you pay a daily coinsurance. Beyond 90 days, you dip into lifetime reserve days, and those are limited. The takeaway? Part A handles the big stuff: hospitalizations and serious care. Most people get it premium-free, but there are still out-of-pocket costs. Part B is your medical insurance. Think of it as everything outside the hospital: doctor visits, outpatient procedures, lab work, x-rays, mental health services, durable medical equipment like wheelchairs, and preventive care like flu shots and annual wellness visits. Unlike Part A, everyone pays a premium for Part B. In 2026, the standard premium is $185 per month. If your income is higher, we're talking above $106,000 for individuals or $212,000 for couples. You'll pay more. That's called IRMAA, the Income-Related Monthly Adjustment Amount. Fun name, not so fun surcharge. After you pay your premium, there's an annual deductible of $257 in 2026. Once you hit that, Medicare generally covers 80% of approved services, and you pay the remaining 20%. And here's the thing, that 20% has no cap. If you need a $200,000 surgery, your 20% is $40,000. That's why supplemental coverage exists, but we'll get to that in a minute. Now, Part C, also called Medicare Advantage, is where things get interesting. This isn't an add-on. It's an alternative. When you choose a Medicare Advantage plan, you're getting your Part A and Part B coverage through a private insurance company instead of directly from the government. These plans often bundle in extras that original Medicare doesn't cover: dental, vision, hearing, even gym memberships or meal delivery after a hospital stay. Many Advantage plans also include Part D drug coverage built in. And here's the kicker. A lot of them have $0 monthly premiums beyond your Part B premium. Sounds amazing, right? There are trade-offs. Medicare Advantage plans use provider networks, HMOs, and PPOs, so you may be limited in which doctors and hospitals you can use. They also have annual out-of-pocket maximums, which is actually a pro. Original Medicare doesn't have one. But if you travel a lot or want to see any doctor anywhere, the network restrictions might be a deal breaker. About half of all Medicare beneficiaries are now on Advantage plans. Whether it's right for you depends on your health, your doctors, and where you live. Part D covers prescription drugs. If you're on Original Medicare, that's Parts A and B, you'll want to add a standalone Part D plan for drug coverage. If you're on a Medicare Advantage plan, drug coverage is usually already included. Part D plans are sold by private insurers, and every plan has a formulary. That's the list of drugs it covers. Plans vary a lot, so you want to pick one that covers your specific medications at a reasonable cost. Here's a big win for 2026. Thanks to recent legislation, there's now a $2,000 annual cap on out-of-pocket drug costs. Before this cap existed, people with expensive medications could pay tens of thousands a year. This is a game changer for anyone on costly prescriptions. Remember how I said Original Medicare leaves you with 20% coinsurance and no out-of-pocket cap? That's where Medigap plans come in, also called Medicare Supplement plans. These are standardized policies sold by private insurers that help cover what Original Medicare doesn't: deductibles, coinsurance, copayments, even emergency care abroad. The plans are labeled by letter A, B, C, D, F, G, K, L, M, and N. The coverage is standardized by the government, so Plan G from one company covers the exact same things as Plan G from another. The only difference is price. The two most popular plans in 2026 are Plan G and Plan N. Plan G covers almost everything. You only pay the Part B deductible. Plan N is a bit cheaper, but has small copays for some office visits. One critical thing: Medigap only works with Original Medicare. You cannot have a Medigap plan and a Medicare Advantage plan at the same time. It's one path or the other. Timing matters a lot. There are 3 enrollment periods you need to know. First, your initial enrollment period, or IEP. This is a 7-month window. It starts 3 months before your 65th birthday month, includes your birthday month, and extends 3 months after. This is your golden window. Sign up during this period, and everything goes smoothly. Second, the annual enrollment period, AEP, runs October 15th through December 7th every year. This is when you can switch Medicare Advantage plans, change your Part D plan, or move between Original Medicare and Advantage. Changes take effect January 1st. Third, special enrollment periods, SEPs. These are triggered by life events, like losing employer coverage, moving to a new area, or qualifying for Medicaid. If something changes, you may get a special window to make adjustments. Before we wrap up, here are 3 mistakes I see people make all the time. Mistake number 1, missing your initial enrollment period. If you don't sign up for Part B when you're first eligible, and you don't have qualifying employer coverage, you'll pay a late enrollment penalty of 10% for every 12-month period you were eligible but didn't enroll. And that penalty lasts for the rest of your life. Don't let that happen. Mistake number 2, assuming Medicare covers everything. It doesn't. Original Medicare does not cover dental, vision, hearing, or long-term custodial care. If you need those, you'll need additional coverage. Mistake number 3, setting it and forgetting it. Plans change every year: premiums, drug formularies, provider networks. Take 30 minutes each fall during AEP to review your coverage. It could save you hundreds or even thousands of dollars. If this video helped clear up Medicare for you, or for someone you love, do me a favor and hit that subscribe button. We're going to keep breaking down every piece of Medicare on this channel so you never feel lost or overwhelmed. Drop a comment below with your biggest Medicare question. I read every single one, and your question might become our next video. And if you want to compare plans side by side for free, check the link in the description. It's the best tool I've found for finding the right plan in your area. In our next video, we're doing a deep dive on the biggest decision in Medicare: Medicare Advantage versus Original Medicare with a supplement plan. We'll compare costs, coverage, flexibility, everything you need to pick the right path. You don't want to miss that one. Thanks for watching Medicare Simplified. I'll see you in the next one.